Yes,
Hello there. Hello, Miss Tawana. How are you doing?
I'm good. How are you?
I'm good, thank you. My name is Tiffany, and I will be your nurse for today.
Hi, Tiffany.
Hello. So, Miss Tawana, what brings you here today?
Really bad stomach pains.
Okay. On a scale of 0 to 10, 10 being the worst, what is your pain score right now?
Right now it's about a 2 because they gave me some pain medication when I was in the ER.
Oh, okay. Well, I'm here. We're going to do a full head to toe assessment.
Okay.
And so, can you please tell me your name and date of birth? And I would like to look at your wrist. Please, look at your man.
Tawana Familaro, May 21st, 1970.
Okay. Tawana Familaro, May 21st, 1970. Very good. And Miss Tawana, do you know where you are right now?
I am in Brandon Hospital.
Okay. Do you know what year it is?
2021.
And who's the president?
Our president is President Joe Biden.
Very good. So basically what we're going to do, we're going to start from the top of your head and work our way all the way to the bottom of your feet.
Okay.
We want to make sure that there's no lumps or bumps or anything like that in your head. We want to make sure that your neck is nice and supple. I'd like to check your skin for any bruising, any lesions, any swelling, redness, stuff like that. And since you are having stomach pain, we can really focus on that tummy, okay?
Okay.
All right, and then I'll also start checking your legs to make sure that there's no redness. All right? All right, so for your safety, I wash my hands.
Okay.
And I also have closed the door for your privacy, okay?
Okay.
All right.
Thank you.
So we wash our hands for a full minute, okay? To ensure that we have proper hand hygiene. Okay, washing my hands for a full minute. Okay, I wash my hands for a full minute. Okay. Okay. This one, I'm gonna get some gloves
Okay.
so we can start our assessment, okay?
Okay.
All right. And I brought my vital signs machine here so we can take some vital signs. Is that okay with you?
Yes.
Wonderful. I just like to establish, what your blood pressure is, what your respirations are, your heart rate, okay?
Okay.
All right, I'm gonna put this on for you. And this is also an opportunity for me to go ahead and start looking at your skin
Okay.
as I'm putting on your blood pressure cuff, okay?
Thank you.
You're welcome. Okay. Okay. And then I'm gonna go ahead and check your oxygen levels. You put this on your finger, please, to check your O2 saturation. Okay. And then I'm gonna go ahead and check your temperature. All right, here we go. And your oxygen is at 97%, very good. Your pulse rate is 70 beats a minute, and normally it's between 70 to 100, okay? Very good. Your temperature is 97.9. Very good. And we're still checking that blood pressure. And as we're waiting for your blood pressure, I just like to go ahead and check your facial symmetry. Make sure your nose is symmetrical to your face. I don't see any signs of deviated septum, anything like that. That's very good. Okay. All right. So it's showing that we have a very good blood pressure of 119 over 78. Very good. All right. All right. So it looks like you're in a very good position, so we can start our assessment, okay?
Okay.
All right. So you may not know this, but I was asking you a couple of questions to gauge your level of consciousness, okay?
Okay.
And you are alert and oriented times 3. You know the president, you know the date, and you knew your name and birthday. Okay? Very good. All right. So this is called a pen light. Okay? I'll be using this throughout our assessment. Okay?
Okay.
All right. So now, if you don't mind, do you mind if I go ahead and start touching your head? All right. And the reason I'm doing this is to check for any lumps or bumps or contusions. Okay?
Okay.
All right. Everything looks normal here. Very good. All right. Now I'm going to move on down to your neck. Oh, your neck is very supple. You must drink a lot of water. Very good. And then I kind of just pinch your skin right here to make sure you have good skin turgor, okay?
Okay.
All right. So I'm going to get my pen light. Do you mind if I check your pupils to see if they're equal and round and reactive to light?
Okay.
Very good. So I'm going to shine it in your eye, okay? Very good. And your pupils are round, equal, and reactive to light. Very good. Do you mind if I take a look inside your ears?
Okay.
And the reason I like to do that is to check for any drainage, any signs of infection. Then I also get to come back here and look if there's any contusions or anything back here, okay?
Okay.
Can you turn your head for me? Thank you. Very good. Wonderful. Okay, can you do me a favor and swallow for me? Did you have any difficulty swallowing?
No.
Very good. All right, can I take a look in your nose?
Yes.
Very good, very moist. Okay, can you close one nostril for me? Do you smell the alcohol that's on my pen light?
Yes.
Okay, can you close the other one? Can you smell the alcohol that's on my pen light?
Yes.
Very good. Okay, would you mind opening up your mouth for me? Very good. I like to look in your mouth to make sure that your mucous membranes are moist. Could you go ahead and stick your tongue out for me? Very good. Can you put your tongue up and down? Left to right? Very good. And open your mouth wide and close it for me. Very good. Your teeth are intact without any chips. Very good. Very nice smile. Okay, so I need you to take a look at my pen light.
Okay.
And I'm going to need you to look at my pen light without moving your head. Okay? Ready?
Yes.
Here we go. Very good. Good job. Okay. Now, do you mind if I take a listen to your heart sounds? Very good. Okay. I'm going to go ahead and put the flat end of my stethoscope here.
Okay.
I'm going to undo your gown just a little, okay?
Okay.
I like to make sure your chest is exposed so we can check for any bruising, any lesions, or swelling, okay?
Okay.
All right. 1 and 2. Okay. Now, do you mind if I check your lung sounds?
Okay.
Okay. Go ahead and give me a deep breath. In and out. Okay. So your lungs are clear on your left side. Lungs are clear on your upper right. Clear on your lower left lobe. Okay. Clear down there. All right. Now, if you don't mind, can I take a listen to your back?
Okay.
Okay. Give me a deep breath in and out. 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 Very good. And while I'm back here, I just like to take a look at your back. Make sure there's no bruising, any cuts or anything like that, no kind of swelling.
Okay.
Very good. Okay, you can lay back down.
Yes.
All right, now if you don't mind, I'd like to take a listen to your tummy.
Okay.
Thank you. And before I do that, I just like to take a look at your stomach and check, see if it's round, to see if it's distended, If one side is bigger than the other, your stomach looks really good. Now I'm gonna take a listen to your bowel sounds, okay?
Okay.
Okay. And if I don't hear anything, then I listen for a full 5 minutes, okay? Luckily for you, we hear something.
Oh, that's where it's tender at.
That's where it's tender, right? Okay. All right, very good. Now, if you don't mind, I'm gonna palpate your stomach, okay?
Okay.
And I'll be sure to be gentle. And if you're experiencing any discomfort, you stop me at any time, okay?
Okay.
Okay. All right, you ready?
Mhm.
How's that?
Okay.
How is that?
Ooh, that's where it hurts.
That's where, okay. How about this side?
A little bit.
A little bit there too?
Mhm.
Okay. Now, Tawana, tell me about your diet.
I'm a nurse, so you know I barely get to eat sometimes, and then
Okay.
when I do eat, it's like whenever I get to eat.
Okay. How many times a day do you get to eat on your days off?
I try to eat about four meals a day.
4 meals a day? Okay. Now, are they home cooked meals or do you go out to eat?
I try to do home cooked meals most of the time.
Okay. All right. Did you eat anything out of the ordinary in the past couple of days?
No.
How about when was your last bowel movement?
Yesterday.
Yesterday. Are they pretty regular?
Yes, I usually go every day.
Okay. What about when you urinate?
It's okay.
Yeah.
I can find.
Is your urine clear? Is it cloudy?
Oh, it's pretty clear.
Okay.
I drink a lot of water.
Okay. So do you don't have any pain or anything when you urinate?
No.
Okay. How about when you have bowel movements? Is it hard? Is it soft? Do you feel like you have to like push down really hard?
For the past 2 days since I had the pain, I feel like it's hard.
Okay. Any nausea and vomiting?
A little nausea, but they gave me something downstairs.
Okay. Good. Okay. Now, if you don't mind, I'm gonna take a look at your lower extremities. Okay.
Mhm.
Okay. I'm sorry, but before that, do you mind you put your arms out for me? I just like to uncover your feet there. Okay. All right. So again, I'm just taking a look at your skin. Make sure there's no cuts and bruising, anything like that. Very good. Okay, very good. Can you raise your arms over your head? Very good. All right, put your arms down for me, dear. All right, I'm gonna check your pulses, okay?
Okay.
Very good. Nice, strong pulses. All right, can you grip my fingers for me? Very good. Okay, so I'd like to check your cap refill. Capillary refill, here we go. Okay, this hand now. Am I causing you any discomfort?
No.
Very good. Okay. Now can you go like this with your arms? Very good. Okay, you can put your arms by your side. Now I'm gonna pull your sheet up over here. Now when I check for your legs, I'm just checking for any redness or swelling, any like bulging veins, anything like that, okay?
Okay.
And if at all, anytime you feel any discomfort, you stop me, okay?
Okay.
Okay, how does this feel?
Okay.
Okay, next leg. Is that good?
Yeah.
Okay, so I don't see any swelling. I don't see any bruising, no redness. So it looks like we don't have to worry about any DVTs. Very good. Okay, I'm gonna come feel your pedal pulses here. Very good, nice, strong, 2+. Okay, can you push down on my hands? Can you push up on my hands? Very good. All right, can you put your legs up for me? Very good. How did that feel on your stomach?
Okay. Like I said, they gave me some pain medication downstairs.
Okay,
So right now, it didn't hurt until you really palpated it.
gotcha, okay. Now, Ms. Tawana, when was your last menstrual cycle?
Actually, I'm on my cycle right
Okay, now do you feel like you have a lot of cramping when you're on your cycle, or is it just pretty much normal?
now. It's pretty normal.
Do you bleed heavily or no?
No.
Okay, are you sexually active?
Yes.
Okay, do you use contraception?
No.
Okay, so just so you know, if you would like to avoid pregnancy, you go ahead and use contraception. and to avoid STDs and any other diseases like that, it'll be wise to use contraceptives. But if you're in a monogamous relationship, hopefully no one has to worry about that. Okay? All right. Are there any other questions that you have for me?
What do you think they're gonna do about my abdominal pain?
Okay. So the doctor, he's doing his rounds right now, and so he'll be coming in here to tell you what tests and what treatments we're going to provide. Okay?
Okay.
All right. Well, thank you very much.
Thank you, Miss Tiffany.
Thank you, Ms. Tawana.